Hey guys, my name is Samuel Richman, and this presentation will be done by myself and Sidnie Anderson. Unfortunately, the third person in our group, Nicholas Frank, has a neck injury and was unable to present, but he did help a lot with the presentation. So our presentation is titled Legalizing Physician-Assisted Suicide. The purpose of this presentation is to argue why we believe that a physician-assisted suicide should be legalized across not only the U.S. but the world, ideally. We believe that as American citizens, we have the constitutional right and freedom of having the ability to make our own choices when facing death. Again, that's just something we believe that is the right of every person in America. So what is physician-assisted suicide? I'm sure you've heard of it. It's a pretty common topic, but it is essentially when a physician facilitates and or gives information to enable the patient to perform the life-ending act. For example, if a patient asks for sleeping pills and the physician gives them those sleeping pills, informs them of the lethal dose, all while knowing that this patient is either considering using them to commit suicide or will use them to commit suicide. They're just giving them the tools and information to go ahead and do that themselves. Right now, where it's currently legal in the US is Washington, Oregon, Colorado, Hawaii, Maine, New Jersey, California, and the District of Columbia. As far as where it's legal in the world is the Netherlands, Belgium, Colombia, Luxembourg, Western Australia, and Canada. So between the United States and the world as a whole, it's not very many places allow this to happen. So it has gone up as far as where it's legal within the last 5 to 10 years. I assume it will continue to go that route, but it's just taken quite a long time for more and more states and countries to get on board with this idea. So there's quite a few pros to this thought or this action of having a physician assist you in suicide. First, it's going to relieve a tremendous amount of pain and anguish for patients who are suffering from terminally ill sicknesses, right? So a lot of those times those illnesses just really destroy your body and put you in a ton of pain. And I think someone who knows they're going to die, say within the next 6 months, and is in a tremendous amount of pain, they should have the choice to say, hey, I just want to end this now and not go through the rest of that pain. So that's a pro to it. Another is, again, the right to die should be one that the patient can exercise. If you choose to die, again, that's a right that we feel you should be entitled to. Another one is sick patients can die with dignity, right? A lot of times these illnesses will, again, destroy your body, put you in a state where you might have to be helped to do things as eating, going to the bathroom, washing yourself. A lot of people don't want to be put in that position, especially elderly people or, again, people who are terminally ill. So having the choice to end that before it gets to that point would leave them with that dignity. Healthcare costs would be reduced. So again, keeping someone alive in the hospital or putting them into an assisted living facility is very expensive. A lot of times insurance will cover the bulk, but once that individual does pass, those costs get put onto the family members, which can be very burdensome. So giving people the choice to end it before it gets to that point, even just for their family's sake, again, is an option that should be one that people can exercise. Nurses and doctors would have more time to spend with patients who are savable, who want to be alive, which obviously is a huge benefit. And then pain and anguish of family members would be lessened. A lot of times people are unable to be with the person who is passing, and they may blame themselves for not being there. This way they'd be able to have a set date. Family members can be there, say goodbye properly. It's just going to be less embarrassing, partially on the part of the patient. A lot of times when those last minutes of life, naturally, they aren't themselves at all, and that can leave them feeling horribly, as well as leave not great memories of them to their family members. So this way, before they get to that point, they can be aware of what's going on. They can just leave better memories with their families. So those are a lot of the pros that should be considered with this. And that concludes my part of the presentation. Sidnie Anderson is now going to go ahead and pick up where I left off, so she'll take it from here.
We recognize physician-assisted suicide and euthanasia is not a new topic. Over half a century ago, there was a popular article publicized entitled, "Euthanasia, Our Right to Die." The subheading read, "The issue is not life or death. The issue is which kind of death, an agonized one or a peaceful one." As Sam outlined, we want to present more than just the idea of physical agony or peace when facing death. Yes, pain and anguish must be considered, but there are other aspects to think about, including personal dignity, family, finances, time and expertise of medical professionals caring for those who can and wish to be saved, and emotional anguish of loved ones who should also be considered. I would like to address the cons as I go more into depth with each of these points. However, we feel that the pros outweigh the cons, and we will be doing this to further support our position on legalizing physician-assisted suicide, as it is an important medical, legal, and ethical issue. The Netherlands is one of the few countries where this is legalized. There are conditions that are absolutely required, though. One of these conditions is that the patient must face irreversible, protracted, and unbearable suffering. Why do we insist that a person face irreversible and unbearable suffering? I actually found an article where a religious Christian leader said that he believed suffering was part of our earthly existence, that facing death and the suffering that goes with it is what we should and what we must do. In a country where we fight for personal privileges, civil liberties, and inalienable rights, shouldn't one of them be to choose not to suffer if it is not necessary? Patients most commonly request physician-assisted suicide because of concerns over loss of autonomy and fear of dying in pain. Of course they do. So I interviewed Christy Baker. She is a registered nurse at Timpanogos Hospital, and I knew that she had some personal and professional feelings about this specific topic, and she shared this personal experience. Okay, so she says, "I have had a few personal experiences in my life that have made me believe that euthanasia and physician-assisted suicide are more moral than allowing someone to die in pain and in fear. My mom had suffered for years with a heart condition. She had an LVAD placed in her abdomen. This left ventricular assist device was put in place as a bridge to keep her alive until they could repair her heart. After a period of time, the device began to fail. They did physical testing on her and decided she was not an appropriate candidate for surgery to replace the LVAD. So she would live until the device failed. It began to skip and grind. The alarms hooked to it would screech. One day we knew it was her last day. The device was failing completely, alarms were going off, lights were flashing. All of us kids were around her watching her gasp for air, cry in pain, and feel completely terrified. We watched our family helplessly try to make it work by trading out batteries and running for help. We watched this for 8 hours until she took her final breath. I believe the hospice caregivers should have taken action and allowed her to die in peace and allow her family to remember her hours being calm rather than having her gasp for air for hours while letting her family do nothing but watch." So Christy expanded from that by saying, if we know they're going to pass away, the better outcome would be for them to be able to pass comfortably. Okay. So this suffering is not for the religious leader to choose. The patient should have the right to choose that quantity of life can be sacrificed in the interest of quality of life. Patients should have the right to choose this, and healthcare professionals, if they choose to participate, should be able to honor the voice of their patients by providing comfort and ending the irreversible and unbearable suffering. Okay, so Sam mentioned the cost that might face a family by prolonging life. Some people say you can't put a price tag on life, and making a statement about costs could kind of sound hard-hearted. However, this is for the patient to choose. If it is determined that the patient meets the outlined criteria and framework put forth legally, then this should absolutely be a consideration. Families are being financially devastated trying to care for loved ones who are physically, mentally, and emotionally suffering, and those that wish to request termination of their lives. Even tens of thousands of dollars per month is charged to care for elderly and terminally ill patients. This is astronomical. Our entire lives, we choose how and where we spend our money. The cost can and should be a determining factor if the patient chooses it to be. Doctors and nurses should not be required to participate if they do not wish to. Some believe that willfully taking a life is against everything a medical professional trains for and commits to do. We believe a medical professional can and should be allowed to be a conscientious objector. However, as outlined in Netherlands and proposed by Britain, when euthanasia is practiced in such conditions, no doctor will be successfully prosecuted. Many medical professionals here in the United States wish to be a voice for and an advocate of their patients. Christy Baker, the nurse that I interviewed, added this statement when I asked her if professionally she believed it should be legalized. And she said, absolutely. As a nurse, our primary job is to be the voice for our patients and to be their advocate. By providing them these means, you are just fulfilling your responsibility to them. Okay. She believes that many health professionals believe as she does and should be given the right to assist their patients legally. Patients and their loved ones deserve dignity in life, during the dying process, and in death. Loving memories of that individual when thinking and speaking and acting as themselves should be a privilege and a defended right. It should not be something we can take away. If palliative care is enough and the patient and loved ones want to die naturally, then that is their right. If it is not enough, if passive treatment plans that shorten life are not enough, if pain and unbearable suffering are present, then please allow those who can choose to choose. Respect preferences, honor individuals, and permit physician-assisted suicide by law. Thank you.